My program's about partnering with patients and clinicians in the emergency department to make sure that we make diagnosis better for patients. It's easy to assume that as clinicians, our work is going well, that we're doing everything appropriately and giving patients the right diagnosis, but sometimes that's just not true. The best available evidence suggests that about 5% of patients experience diagnostic errors in the emergency department. Clinicians face a number of challenges behind the scenes trying to make diagnoses correctly. For example, radiology reports may not immediately be available once we're caring for the patients, so we may get information later and then need to communicate findings to patients after they've actually left the emergency department. It's very rare for me to ever get feedback from patients unless I go out of my way to call them and ask them how they're doing. Each time I meet a patient, it's generally for the first time, and then I almost never see them again. So my project that I'm doing engages patients who've been discharged from the emergency department to learn about what went well during their visit and what could have gone better. We enroll patients either right at the time they're discharged in the emergency department or by phone 1 or 2 days afterward, and then we do serial phone interviews with them over the course of 30 days. What we've learned locally is that approaching them at the bedside is more likely to be successful for those who have low health literacy compared to calling them by phone a few days later. I had a little bit of difficulty launching a project that involved participation by both clinicians and patients. So my project is dedicated to learning from experts about how to best navigate these challenges. I talked to some local experts as well as some national experts who've navigated similar challenges before, and they give critical input into a survey. We were collecting information about barriers that folks encountered when doing their research, as well as the lessons learned and ways that they could overcome those barriers in future work. We learned that lapses in communication are probably the most common thing that patients can report. So we're working to develop ways to communicate better with patients. Relationship building takes time. You can dip your toes in, but really you need to connect with people over a period of months or even years to really build the relationships that are necessary to complete challenging work. Diagnostic excellence work is extremely challenging for patients, clinicians. We all want to make it work. And in this day and age when the level of trust in healthcare is at an all-time low, I think this is work that really resonates with patients. And so I think it's of paramount importance to work together with patients and clinicians to make diagnosis better. I've really been trying to lay the groundwork to recruit patients and clinicians in a wide variety of studies, mostly focused on care in the emergency department, but also, for example, another project is to establish a learning collaborative nationwide where we're learning from patients and clinicians at many, many sites. So we're looking to enroll more sites in those efforts as well. My long-term goals about my work are to really build systems of feedback where we can learn from patients and clinicians in real time about when there was a problem and when a problem with the diagnosis needs to be addressed.